All right, everybody. Here is a medical terminology overview for you. Gave you a bunch of resources. The medical terminology is a complex thing, even in with a full amount of time in class. It could take 8, 10, 12, and more hours. Some of y'all pick it up really quick. Others, maybe not as fast. But this will be a good foundation of it, and you're going to continue learning it kind of throughout the class as you get into more specific things. Okay, so really what medical terminology is where you're just using anatomical, medical terms, abbreviations, all of these different things in both written and those handoff reports like we had talked about earlier. Okay, so you're going to need to understand how these words are broken down and a little bit about some abbreviations as well.
Engine 31 signal 50.
All right, so we're going to kind of focus on how we can break down these words and then go from there whenever it comes to translating them into more plain English. All right, so each one of these terms has distinct parts, and we're going to talk about what each one of those are and then how we can decode them. All right, so you've got a word root, or you may hear me say root word, and then there's a prefix, a suffix, and a combining vowel. So let's talk about each of those. Keep in mind that spelling is really important. You can see the example here between the difficulty speaking and the difficulty eating or swallowing. So dysphagia, difficulty speaking, we see this with strokes or someone who has had a stroke with some permanent deficits. You just change that S to a G, and now all of a sudden it means difficulty eating or swallowing. Right, so to be able to decode these, you're going to have a good knowledge of anatomy as well as some contextual things. So that's why as you go on throughout this class and then, kind of throughout your career, you'll be able to pick up on more of it. So to start off, word roots, these are going to be your main part or the overall just kind of stem of a word. This is what the essential meaning is going to be. You can have multiple word roots in one word. A lot of times it's going to really focus on some sort of body part or region along those lines or body system. Okay, so here is an example of how there is one word, but it's two word roots. So cardiopulmonary, cardio is the heart, pulmon is the lungs. You can scan this QR code. If you pause the video, scan this QR code, it's going to take you to a Google Doc that's going to have word roots, prefixes, suffixes, and a bunch of other stuff in there that you can use to help decode some of these things. So prefixes, just like they sound, they begin at the beginning of the word, and they're going to usually do a location or intensity like it says here, and provide a little bit more context and meaning to the root word. Suffixes into the words, right? And that's going to be a disease, a condition, a procedure, a type of specialist, something like that. And then combining vowels are where you take those other three parts and you use combining vowels just to kind of make it make sense. All right, so there's just a quick summary. Remember, prefixes at the beginning, suffixes at the end, combining vowels. When suffixes begin with a consonant, it really helps with pronunciation. Okay, and then there's also parole. So here you can see how you have one vertebra versus vertebrae and so on. Additionally, with prefixes, you can have numbers, colors, positions, directions. So here's some examples of some numbers. So you have uni and so on, which are going to give you two or more types of parts, sides, and we'll get into that a little bit. And there's also going to be colors. So like a leukocyte, that's going to be a white blood cell. Erythrocyte, that's a red blood cell, and so on. And then you've also got positions and directions. We're going to go through several of these towards the end of this. Same thing with directional terms. All right, so we'll get started with those. Obviously, there's right and left. Remember that the right and left is always going to be the patient's right or the patient's left. Superior means closer to the head, while inferior means closer to the feet. Lateral is away from the body's midline, whereas medial is towards the body's midline. Proximal is going to be towards the body's core. Distal is going to be away from the body's core. So you would use superior and inferior whenever you're dealing with something on the head, torso, pelvis, that type of thing. Whenever you get into the extremities, that's whenever you're going to see more proximal, distal. And then there's superficial and deep. Those are pretty self-explanatory. There's some other terms, ventral and dorsal, palmar and plantar, and apex. So we'll break down their superior and inferior again, like I said, closer to the head, closer to the feet. And then lateral and medial. So lateral, if you stretch your arm all the way out and away from your body, that would be lateral. Or if you just stand really still with your palms facing outward, and you look at like the right side of your arm, that would be the lateral side of your arm, whereas the side that's closest to your body would be the medial. Proximal and distal, like I said, closer or farther away from the trunk. Superficial and deep, again, pretty self-explanatory. These are superficial is a pretty common term. Ventral and dorsal, you're not going to hear these a lot. You may very well see them on test questions, but what you will hear a lot is anterior and posterior. So anterior is the same as ventral, which means the front belly side of the body, whereas dorsal, the example is like a dorsal fin, that would be the same as posterior. So anterior, posterior, you're going to hear a lot more. Palmar and plantar, so palmar, palm of your hand, pretty simple. Plantar, bottom of your feet plant to the ground. And then an apex is going to be some sort of tip of the structure. For example, there's apex of the heart, is the inferior portion of the ventricles. So just to reiterate, the tip doesn't necessarily mean that it's going to be like at the top of something, right? It's just showing whatever the tip of that particular structure is going to be. Movement terms, so flexion. If you flex your biceps whenever you bring your arm up to do that, that is going to be actually bending your joint. But whenever you have your elbow fully straightened and locked out, that would be extension. Adduction, you're adding to your body. So if you take your hand and you move it all the way out to the right, if you bring it in towards your chest, that would be adduction, where abduction is going to be motion away from your midline. So some other directional terms, bilateral is going to equate to both sides of the midline. So you have two femurs, so you can have bilateral femur fracture, right? But unilateral, you're not really going to hear this a lot. You're really going to hear like left or right. But unilateral will be just one side of those bodies. Where you can hear unilateral is whenever we start talking about strokes. So anatomic positions, there is the anatomical position, which we'll talk about in anatomy on Tuesday, but that would be where you're just standing, facing out, palms facing forward. That is the anatomical position. So prone, pretty common term, you're lying face down, whereas supine, you would be lying face up. When we talk about Fowler position, here's a little bit better breakdown of it. These are the two that you're going to hear the most. So semi-Fowler, which is what 90% of your patients are going to be transported at, is where they're sitting up at just a slight 45-degree angle. Then there's high Fowler. That's going to be at a 90-degree angle. Those are for some really, really, really bad respiratory distress patients. Okay, so let's talk about breaking down some medical terminology. We've got defining in this particular order here. So we need to have the suffix to go first, the prefix, we're going to do that second. The word root would be third. So let's take a look at this one. Neuropathy. We're going to do the suffix first, but here's how it kind of breaks down, right? We've got our prefix, we've got our root word, we've got a combining vowel here, and then a suffix. So let's look at this suffix first. So pathy means disease. So now we're going to look at our root word. There's the combining vowel, and then the root word is nephro, so that's kidney. So what do you think this word right here means? It would mean disease of the kidney, neuropathy. Dysuria, all right, let's break that down. So this one has a prefix, a root word, and a suffix. So let's do the suffix first. IA, that means condition of. The prefix dis, right? Difficult, painful, or abnormal. UR, urine, okay? So putting all of these together, painful urination. Here's another one, hyperemesis, right? So we have a prefix and a root word, but there's no suffix over here. So doing the prefix first, hyper means excessive. It can also mean, high, but generally it's going to mean excessive or like a lot. And then emesis. So this word root means vomiting. Putting those together, hyperemesis equals excessive vomiting. Analgesic, prefix, root word, suffix. So we're going to start with the suffix, ic. That means pertaining to. Prefix, without or an absence of. And then this word root means pain. So for analgesic, I think that's correct pronunciation there. You're going to see those a lot whenever you're describing pain medication. There you go, pertaining to no pain. All right, so I gave you a worksheet that's got a bunch of medical terms on there for you to break down, so give that a shot. Practice makes perfect with this one. There are some abbreviations, right? So these are used just to help with report writing, things like that. There's some commonly used abbreviations that we'll use. These really are just going to kind of shorten up some notes in your documentation. Again, you're using this whenever you're writing, not necessarily like speaking to others in a handoff or radio report. We do not really use symbols though. I can't really give you an example of that. All right, so we can come through here and review, but I'll give you some examples of some abbreviations. So we have HTN, that is hypertension. ATF, arrived to find. NTG is nitroglycerin.
Engine 10,
A
2509, Fairfax
S
Road, Unit 1H.
A
Back injury.
is
Cross
aspirin.
streets on Burnell Avenue and Hilltop Road.
All right, so looking into some of these review questions, which of the following components of a medical term conveys its essential meaning? Give you some time to think about it. That's going to be C. All right. There's some other rationale for the other answers if you want to pause it. And you're welcome to pause this throughout this review. And, if you want to read something a little bit further, I'm just, for the sake of time, just going to kind of go on through it. All right, so prefixes are going to indicate what? Color, right? Remember how I talked about erythrocyte, leukocyte, so on.
Quad 38 and Station 38, 5322, Onic Road, Hemorrhage.
The plural
Streets are held
form
at
of the
Church
word
Road.
bronchus is D. Right here, bronchi. Okay, so with the bronchus, right, they're talking about this is the main stem bronchus that comes into, starts off your airway, your lower airway, right? And then right in here, it's going to split. So what this and this, these are now bronchi. The statement, the lungs are superior to the bladder, indicates that the lungs are closer to the what? All right, so closer to the head. Superior means closer to the head, and these are going to be used mostly whenever you're describing something that's going on in the core of the body rather than an extremity. Movement of the arm toward the midline is referred to as what? Adduction. Remember, you're adding to your body.
5322 Amick Road, Cross Streets, Alameda, Church Road, on Hemorrhage College.
A body part that lies closer to the midline when compared to another is considered to be what? Answer is going to be A, medial.
Quad 12 around.
All right, so this is used to identify a body part that is on the belly side or anterior surface of the body.
12 is responding to 8404 Poplar Bluff Drive, Cross Streets, Backbridge Drive on an overdose call on 23 Charlie.
Remember, here's our correct answer, ventral, but you're going to hear anterior a lot more.
Caller is third party.
Your patient is, you place a patient in the semi-Fowler position for transport. This means the patient is what? Right, answer C. So that's going to be that 45 degree.
Apparently
a laceration is located on the plantar surface, which is on the what? Right, plantar is the sole of the feet.
Headboard is law enforcement around.
A laceration, right? Oh, sorry, that was one we just did. When using abbreviations, acronyms are simple, and EMT should. Now, not really worried about this question. You will not see all of the above questions, all right? Because guess what? They're always all of the above. So we will not be using all of the above questions in testing, either in class or with the state test. So that's a quick review for you. I gave you several other resources, and there is a case study posted on your Jones and Bartlett. We will be going over that thing first thing Tuesday morning.